Welcome, applicants. My name is Dr. Will Chung. I'm the program director for the Marian Regional Medical Center Family Medicine Residency Program. And this is my welcome and introduction PowerPoint to the program itself. So follow along with me. Normally, you guys would be here in front of me, able to ask any questions, but what we'll be doing virtually this year is going through the PowerPoint presentation so you get as similar as experience as possible as you would have had in the past. So first is our mission statement. Our goal is to produce family physicians who upon graduation will be equipped to provide excellent, compassionate, evidence-based care in any setting or environment. We will prepare our learners to adapt to the rapidly changing healthcare environment and help navigate patients through our complex healthcare systems. The education will focus on the fundamentals of clinical medicine while embracing innovation and ingenuity. All of this in an environment that emphasizes quality, safety, and personal wellness. Most importantly, we hope that our residents will stay and fill our local primary care needs and become pillars of the community, representing the essence of family medicine and the core values of Dignity Health. So these are our Dignity Health and Common Spirit core values: compassion, inclusion, integrity, excellence, and collaboration. You will see these at any Dignity Health or Common Spirit hospital. So many people ask, where is Santa Maria? What people don't know, even those that reside in California, is that Santa Maria is smack dab in the middle of the central coast of California. We are located about halfway between Los Angeles and San Francisco, about 3 hours each way. We have a very large agricultural area, a lot of farms, a lot of vineyards. Is one of the largest industries here in this area. We have the largest population out of any city in Santa Barbara County, including Santa Barbara itself. Estimated median household income is about $50,000. But again, we are located smack dab in the middle of the central coast of California, one of the most beautiful places to live. So many of you may ask, who are we? What is the Marian Regional Medical Center Family Medicine Residency Program? Well, I still consider us a relatively new program. We were established in 2014. We are a community-based hospital. We do have our ACGME 10-year accreditation along with ACGME osteopathic recognition, which I believe is still unique among family medicine residency programs in California. We did add an OBGYN program in 2018. The reason I mentioned that is many of you may be looking for single programs out there. I will assure you that with the advent of the OBGYN program, it has been an absolutely 100% collaborative effort. Their attendings and faculty are committed to the education of our residents and vice versa as their residents rotate through our inpatient service. So it's only been an additive advantage to have this particular program with us here at Marian. The big thing about Marian Regional Medical Center, though, is our robust patient population. We have over 75,000 ER visits a year, 9,000 admissions per year, and we do over 3,000 OB deliveries a year. So plenty of babies to be caught all around. Just a little bit about our patient demographics. This comes from the US Census in 2010. I just want to point out that our very large minority population does consist of the Hispanic or Latino population. However, we do have quite a large population of Mixteco speaking patients from the Oaxaca region of Mexico, and they are part of our very vulnerable patient populations. And it is part of our mission to serve the underserved and disenfranchised. So the migrant farm workers, certainly the homeless, the uninsured, the undocumented, and one thing that's also unique to our population is our retirees. We have a very large geriatric population, which in and of itself presents a very nice educational opportunity. So where will you be spending the vast majority of your time is in the Family Medicine Center. The vast majority of you guys are going to be going out and practicing primary care, and in whatever setting that you choose. Hopefully you'll stay here in our area. But of course, at the Family Medicine Center, you'll have many things at your disposal to properly care and manage for your patients, including an EMR, which we use Cerner. We have multiple point of care resources, including hemoglobin A1C, urine microscopy, EKG, a hemoglobinometer, a spirometry, and new this year with Dr. Luke Rawlings is our point of care ultrasound program. We also have evidence-based medicine resources, including UpToDate and Dynamed Plus. And then we also have documentation resources, which are vitally important to efficiency and resident wellness, including Dragon and a shared scribe documentation process called Augmetics that we have implemented here at the Family Medicine Center. We also have multiple specialty clinics, including a high-risk infant follow-up clinic for those NICU graduates. We have a procedure clinic manned by Dr. Dawes, where we do a lot of joint injections, skin procedures, and such. We have an OMT clinic where our patients can seek that sort of specialized treatment with our osteopaths and those MDs who choose that path of training. We do all the sports physicals at our clinic for the local high schools. We also provide a transitional care management clinic for those hospital discharges that can't get in to see their PCP in a timely fashion. We have a nephrology clinic with Dr. Jim Jones, who is a nephrologist and an outstanding teacher who just recently won the Teacher of the Year award. A behavioral health clinic that Dr. Dawes is starting up this year as well to provide more comprehensive mental health services for our patients and those in our community. And then Dr. Ann Kennard will be starting an integrative and lifestyle medicine clinic, which we hope to offer to patients throughout our community. Of course, especially in your first year of training, you guys are going to be spending a lot of the time in the hospital. So let me just tell you a little bit about Marian Regional Medical Center itself. We still call it the new hospital, even though it's about 8 years old, built in 2012. It's a 191-bed, state-of-the-art building. We have a 21-bed NICU, a 42-bed ER that has since been expanded. We have a 20-bed open critical care unit and plans for a pediatric critical care unit as well. We have advanced cardiac services, including STEMI. We have comprehensive cancer services through Mission Hope Cancer Center. We have a bariatric center, which is also very busy. We are considered a primary stroke center. And we are currently moving from a level 3 to a level 2 trauma center. I think the biggest thing I can say about Marian, though, is its track history of quality and safety as evidenced by multiple awards we have received, including most recently Newsweek's Best Maternity Care in 2020. One of the advantages of our program is that we have also taken over care of the majority of patients at Marian Extended Care Center. This is our 95-bed skilled nursing facility where half the units are long-term care patients that our residents care for, and the other half are short-stay rehab patients discharged from various hospitals in the area. I will say, as far as a nursing facility, it is by far the best nursing facility that I have ever worked at, and I'm so proud that our residency program has now taken over the management of the patients there and working with the extraordinary staff to care for our community. Of course, residency is not all work and no play. One of the best things about being on the Central Coast is that when you leave work, you have so many things at your disposal to relieve all that stress and anxiety. Whether it's surfing, mountain biking, hiking, golfing, if you're into wines, we have hundreds of vineyards just within an hour's drive from here. Whale watching. Like I said before, the Central Coast is one of the most unique and most beautiful locations that you could ever live in. And to be able to live in an area like this while you are training for residency, it says a lot about the wellness and being able to take care of yourselves. So a little bit about the bread and butter curriculum. During your first year, of course, this is mostly going to be inpatient focused. We're going to be focusing on developing basic patient care principles, clinical decision making, efficiency and communication. The vast majority of your rotations will be in the hospital, including adult inpatient medicine, obstetrics, pediatrics, including a stint in the NICU, general surgery, and emergency medicine. You'll also have cardiology and outpatient pediatrics as part of your rotation in the first year. As we move on to your PGY2 year, you'll notice that we move more from an inpatient focus to an outpatient focus. Of course, goals include graduated level of independence and responsibility. We're going to start to develop your procedural skills, and then also you're going to have an increased amount of leadership on the patient care teams. One of the biggest changes we have made this year is we have changed the night float experience from 4 weeks to 2 weeks. We did that based on feedback from residents saying that the 4-week experience was just a little bit too long to be on nights and a little bit too isolating. So for resident wellness, we divided that into 2-week blocks and backed it up with outpatient 2-week experiences such as endocrinology, oncology, urology, and ear, nose, and throat. The other big experience during your second year is the geriatric experience over at Marian Extended Care Center, where you'll be working with Dr. John Campbell, our new geriatrician. There you'll be taking care of the short stay rehab patients, as well as helping other residents manage their long-term care patients. The one thing I do want to note during your second year is you do have one elective opportunity during your second year with which you can plan a rotation around your special interest. Of course, as we move on to your third year, we are really getting you prepared for graduation and for the boards, where you're going to be developing master clinician skills. You're going to be in charge and supervising junior residents as well as medical students. Of course, we're going to be getting you ready for your boards and provide you even more opportunities for leadership and administrative responsibilities. Again, this curriculum is focused on the outpatient setting, getting you guys ready for a career in primary care. That is why we have 3 electives available to you to shore up any educational deficiencies that you may perceive to have happened during your residency program. Again, you'll be in charge of the Marian Extended Care Center, taking care of the short stay rehab patients as well as long-term care patients, and you will be leading the family medicine inpatient service for 2 blocks during this year. So I do want to point out that we do have 2 specialized tracks here at the family medicine program. The first one is the osteopathic manipulation track. This OMT track is as a result of us being one of the first and I believe only programs currently to have osteopathic recognition. We absolutely value osteopathy and our DO graduates, and we want to provide an experience and education to continue to develop those OMT skills. So as part of that, Dr. Victor Polito, who's our Director of Osteopathic Education, has put together a very nice curriculum that includes an OMT clinic, quarterly workshops, a journal club, scholarly activity. We do provide an opportunity for our residents to go to convocation as well. And he's currently in the midst of developing an inpatient consultative service. The other specialized track that we are proud to say that we have is the integrative medicine track. This is in collaboration with the Weill Center for Integrative Medicine at the University of Arizona, which is one of the leading centers for integrative medicine. This track is led by Dr. Annie Kennard, who is a board-certified OBGYN, but also certified in integrative medicine through the Weill Center for Integrative Medicine. She heads up our wellness curriculum as well, and with this integrative medicine track, we do have online curriculum provided by the Weill Center, but I think even more importantly, we are going to be offering an integrative medicine clinic where you can actually put what you learn to use. We're going to also be having a lifestyle medicine group visits, and we'll continue to provide opportunities for our residents to go to the annual Integrative Medicine Conference at the University of Arizona. So just a little bit about benefits. We do pay you. I say this every year. It may not seem like it's much if you break it down into an hourly rate, so I don't encourage you to do that. But compared to some of the UCs, I feel like we are very competitive with our salaries. I would like to point out that we provide a housing allowance, $300 a month. We do live in California, and even though the Central Coast might not be as expensive as the Bay Area or Orange County, we still recognize that the cost of living is a little higher here, so we provide a monthly housing allowance for you to put towards your rent or use otherwise. That's totally up to you. You also have an annual educational stipend, or CME, up to $3,000 annually, along with 5 days. I will point out that's actually $500 more than our faculty get, so good for you guys. The other thing is free meals, free parking, so you don't have to pay for that, which is really nice. You have 4 weeks of vacation, and depending on where you're coming from, you may qualify for moving expenses. Of course, the big reason why we've recruited you here is that we are really hoping that many of our graduates will come to love the area as we all do and put down roots and stay in our area to fulfill the primary care needs of the Central Coast. So there are multiple opportunities out there, including large healthcare organization affiliated practices such as Dignity Health and Pacific Central Coast Health Centers, but there are multiple private practices out there that are hiring our graduates. There's opportunities for academic appointments with the residency program. We've had several residents go on to be hospitalists and join our hospitalist group here. We have a very large FQHC network and community health centers. So that is another opportunity. Of course, we also have a VA locally. And then we have also had a couple of residents move on to fellowship. So those are all opportunities for you guys. So I'd like to end this by saying, obviously, you can't ask me any questions at this time. I will invite you to email Annabelle Pereira, our program coordinator, with any questions you may have. Hopefully, you'll have the opportunity to ask your questions during the interview. I do want to mention that the members of the CAFP several years ago got together, and we all decided that we are not going to initiate any contact with the applicants after the interview. Now, that's not to say that we aren't interested in you. Of course, we are interested in you. That's why we are inviting you out for an interview. However, we will not initiate contact, so don't think that to mean that we don't have any interest. In fact, if you were to contact us after the interview and ask any additional questions or send us a thank you card or email, we'll certainly welcome that and reply to any of the questions that you might have. I want to thank all of you guys for your interest in the Marian Regional Medical Center Family Medicine Residency Program. I hope to see all of you here on campus in the near future, but if not, at least a virtual interview. Thank you very much.